ಬೆಂಗಳೂರು ನ್ಯೂಸ್ ನೆಟ್ವರ್ಕ್.
ವಾಣಿಜ್ಯ ಹಾಗೂ ಇತರ ಸುದ್ದಿಗಳನ್ನು ಅಂತರ್ಜಾಲದಲ್ಲಿ ಬಿತ್ತರಿಸುವ ಪ್ರಪ್ರಥಮ ಇಂಟರ್ನೆಟ್ ಚಾನೆಲ್
ಬೆಂಗಳೂರು ನ್ಯೂಸ್ ನೆಟ್ವರ್ಕ್.
ಪ್ರಪಂಚದಾದ್ಯಂತ ಸುದ್ದಿ ಬಿತ್ತರಿಸುವ ಮಾಧ್ಯಮ
ಬೆಂಗಳೂರು ನ್ಯೂಸ್ ನೆಟ್ವರ್ಕ್. ಲಾಗ್ ಆನ್ ಆಗಿ
www.bangalore-newsnetwork.com
www.bangalore-newsnetwork.com.
He's in a way, though avascular necrosis is not new to us, his treatment is very much new. He had what we call as advanced avascular necrosis, which was in stage 3. For such a case, we only do surgery or bone graft or try to do a joint replacement if the symptoms do not improve. He became important in two aspects because he is a well-educated patient living in Pakistan, having his family members based in America. So he did a lot of research to see if there was any treatment available other than surgery for his problem in the hip joint. So after doing 1 month of research, he posted his problem on a blog for avascular necrosis patient. So one of our patients from Jodhpur who got treated by us in Bangalore, she posted on the net saying her problem and what has been her experience and how she got better. So because of that, he connected with her and he spoke at length what she was feeling. Then his entire family members, including her sisters and parents from America, they called me. They said they had already consulted several doctors in France and America, and since all of them offered surgery, they were looking for a non-surgical option. Because he is only around 30 years of age, so he came to Bangalore for stem cell treatment. And with stem cell treatment, what we did, we took his own stem cells from his bone and then the growth factors from his blood, and we prepared the cells to form a cartilage tissue in his hip joint. And he is now doing very well, and he has seen the other patients while he was here, and he is very much convinced that he is going to get better, because we've already done 28 such patients and all of them have recovered from stem cell treatment. We have about 52 patients we have treated for various conditions. For this particular specific condition of advanced avascular necrosis, we have treated 28 patients. It was already in advanced stage of stage 3. That means it requires either surgery or a joint replacement. He was in severe pain. He was not able to walk more than 10 steps, and he was already using a walker because he was not able to put weight on the leg. Now he's already seen the difference and he is feeling much better now. This kind of problem comes because of drug induced, what we call, because if they use steroids for some condition for more than 1 or 2 months, or sometimes because of excessive alcohol or tobacco abuse, or sometimes it could be without any reason at all. He's one of those patients who had no other cause, but just that blood supply to his hip joint got completely blocked and his part of the bone started.
My treatment involves 3 different infusions of stem cells. I've already had 2, 1 is remaining. Until all the treatment is complete, I cannot, analyze, and neither can the doctor, how much progress I've made. But overall, I feel confident in the treatment because of what I've been told, and about the stem cells, I feel there's a lot of potential. So, right now I feel better than before, but I cannot say until the complete treatment is finished, and also when I get my MRI done again. The thing with that is I don't have anybody in my family that has this kind of illness. This is a very rare disease. Only 20,000 people in the United States per year get this. It's not surgery. It's basically infusion, which is just like you take an injection and you inject the patient. But the only difference is it's not an injection you get in your body. It's more like, they have to drill it in and then they have to inject it. Foreigners ke liye, when they come to India, that, it's when you come in to any country for the first time, you don't know the culture, you don't know what's going to happen. So you want it to be less complicated. The problem that I faced when I came to India for my first time coming here to India is that there are regulations. I have to go foreigner registration office, multiple trips we have to make. When we come, we have to go. When we leave, we have to go. We have to get police reports. Very many unnecessary things. I mean, I've traveled to many countries in my lifetime: China, Malaysia, Singapore, Turkey, England, America. I've never had this problem ever in any country. And I'm sure there has to be some protocol for Indians when they come to Pakistan. I'm sure they face a hard time too. So that's why I insist to both our governments that they should, have more dialogue and make it easy for their citizens, which is their job as politicians, to make life easy for the citizens, not for themselves.